my name is Lisa. I'm going to be your nurse today. I'm just going to reach over you just to verify your name and your date of birth. If you could just tell me. Charlene Knight, 8839. Okay, great. And your allergies? Betadine, PCN, and latex? Okay. We'll make sure not to use any of those today. I just wanted to stop by to see how you were doing. I saw on your chart that you have not been able to urinate in about 10 hours. You feel like you have to go to the bathroom but nothing will come out? Okay. Well, let me just put some gloves on and just be able to assess you. I'm going to roll this down. I know it's a little chilly in here, but I promise to go as quickly as I can. Yes, your abdomen is distended, so we actually have a order from your physician for a Foley catheter. You've had that done before? Okay, and you're comfortable with the procedure? I know it may be a little bit uncomfortable, but it's going to provide immediate relief? Okay, great. Well, I'm just going to roll this up. I just want to make sure before we get started that you don't need any pericare and everything is clean and dry. If it wasn't, we'd want to make sure we did that before the procedure started. Okay, well, I'm just going to get everything situated. Since this is a sterile procedure, I'm going to have to keep you like this, but I will be back momentarily. Okay, the first thing we'd want to make sure we did is just take a look at the Foley catheter kit. Make sure that it is not expired. This one does not expire until 4/2017, so we're good. We'd also want to make sure that it doesn't contain any of the patient's allergens. This one does have latex, but for the purpose of the video, we're going to pretend that it doesn't. We'd also want to inspect the integrity of the package, making sure there's no compromises, no tears, no moisture. And again, just for the purpose of this video, we're going to pretend that it doesn't. The surface that I'm working on, I want to make sure that it's at waist level, that it's clean and dry. I'm actually going to be utilizing both tables for the procedure, which is okay. I'm going to take this off. And it's a used kit, so it's not in the best condition. I'm just going to throw that on the floor. Just going to rotate this because when I open it, I'm going to open away from me first. Just utilizing the 1-inch border. Okay. So the next thing I do, I'm going to use the drape, and I'm just going to touch the shiny portion of the drape when I pick it up. Just again utilizing the 1-inch borders. I'm just going to turn this around to make it a little bit easier to actually put on the patient, not turning my back on the sterile field. Okay, we're good with that. Now I'm going to put the gloves on. I'm going to take them out of my package. Utilizing the spacer again, not turning my back on the sterile field. Making sure that when I open the gloves that I don't touch the inside, which is sterile. Okay, I'm going to start off by doning my dominant hand, just picking up the glove on the outside, stepping back, and putting my glove on. First one is doned. Next I'm going to use my non-sterile hand just to stabilize the surface, and I'm just going to touch sterile to sterile with the gloves. I'm going to step back, making sure to watch my thumb. Okay, sterile gloves are on. Now I'm going to rearrange my supplies on my sterile field. I'm going to start off by opening the hydrogen peroxide. Oops, one of my cotton balls fell on the floor. That's okay, I have plenty. Typically these kits only have 3. This one actually had a little bit of extra, so that's okay. Just making sure not to pick up the one on the ground. So I'm going to open it up and apply it to the cotton balls. This area over here is no longer going to be sterile, so I'm just going to discard it over there. Okay, next I am going to remove the packaging from the catheter tip. So drop that over there. And I'm just going to go under. It's a used kit, so everything isn't in perfect condition. Next I'm going to apply the lubricant generously to the tip of the applicator. This one, because it is an old package, I had to just put some lubricant in there. Normally it would come out of the package. I'm just going to apply it, like I said, generously to the tip. Okay, and discarded that. Next I am going to take my syringe containing 10 milliliters of sterile water, and I'm going to attach it. And I'm actually going to get rid of this because we're not going to need this today. And that's okay that that fell out a little bit because it did fall on the sterile surface, so we're good. Okay, put everything back in the box, and I'm going to be moving my sterile field over to the patient. So this no longer is going to be sterile. I can turn my back on it. This area over here. Okay, I'm going to use my non-dominant hand to locate the meatus. I'm pulling the labia apart. Once I place my hand in that area, I will not be able to move it. I will only be able to use my dominant hand. So I'm going to put it there, and then I'm going to clean furthest away from me, making sure not to cross my sterile field. Again, this is no longer sterile, so I can drop it there. Closest to me. And middle. And I'm not going to use the additional cotton balls. Like I said, 3 is only necessary, so I'm good with that. Just going to remove this over here. And now what I'm going to do is I'm going to use my sterile hand, and I'm actually going to put the catheter in. Okay, Mrs. Knight, we are going to be inserting the catheter. If you could just take a deep breath for me. When I insert this, I want to make sure not to let this touch anything other than the meatus. And this is a used kit, so having a little bit of resistance right here. There it goes. Okay, I'm going to go ahead and continue to advance until I see urine, which I do, so I'm going to go 1 more inch. Okay, I'm going to stabilize this with my non-dominant hand, and I'm going to slowly inject 10 milliliters of saline water. Okay, I'm just going to take a little tug. It isn't secure, so the sterile portion of the procedure is now done. I'm going to put this right over here. What I would do is I would attach this with a little bit of slack to her leg with some tape, and then I would attach this to the bed frame, making sure that it does not touch the ground and it stays below her bladder. And I do see about 300 milliliters of urine. It is not cloudy, it's amber color. Mrs. Knight, how do you feel? Do you feel much better? Oh, I'm so glad to hear that. I would go ahead and just make her a little bit more comfortable. I would document the procedure, that she tolerated it well. I would monitor her intake and output, while she has the catheter. It also would provide cath care and peri care as needed, typically every shift, 8 hours, or as recommended by my agency.